Welcome to Africa to You. I'm Vivian Birchall, your host. In May of this year, 2019, Harvard Medical School will be hosting its annual Global Health Catalyst Summit. This summit is a unique event designed to catalyze high international collaborations to eliminate global health disparities and curb the growing burden of non-communicable diseases. Last year, I participated as a presenter at this summit on the Wakanda panel. My presentation was about bridging Africa's healthcare gaps with ethnomedicine as a sustainable way to disrupt the healthcare disparities that communities in Africa face. Today, my guest is Oscar Nebangwa, who is the Diaspora Outreach Coordinator for the Harvard Global Health Catalyst Summit. Oscar, welcome to Africa to You.
Thank you so much for having me.
So, tell us more about the Global Health Catalyst Summit.
Yeah, the Global Health Catalyst Summit is a yearly event that we carry out, and the summit itself is one part of the Global Health Catalyst as a whole. This summit is the face-to-face interaction that we usually do every year, where we bring in government officials, business persons, medical professionals, diaspora leaders, and students to brainstorm, to learn from each other, to network, and build strong collaborative out networks, so that at the end of the summit, they'll be able to impact their various communities from which they come. Students will be able to get knowledge when they go back to school. And the summit, its focus is trying to bridge the gap between, it's trying to bridge the health disparity that exists in most African countries and the Western world. You see, our focus is trying to elevate health situations in Africa, low and medium income countries, so that in some distant future, the situation of health in Africa will be much more better than what we have today. The Global Health Catalyst focuses on care, education, research, and outreach. So when you look at these 5 components, it embodies all what somebody needs to be healthy.
Right. So you and Dr. Lydia Asana are part of the African Renaissance Ambassador Corps and part of a team that is organizing the Catalyst Leadership Academy. What is the purpose, and what are the desired outcomes?
Yes, you talked about African Renaissance Ambassador Corporation. This is an organization that I am part of it, and its focus is on helping the shut in. That's the elderly people who can't help themselves. We take care of epileptic patients. We organize AIDS awareness campaigns in schools. We try to educate students, most especially on the effects of premarital sex and things like that. So African Renaissance Ambassador, it's like the mother of the Global Health Catalyst. So this African Renaissance Ambassador existed before GSC came into place. So we got some inspiration from the from African Renaissance Ambassador, and then we said, okay, no, what can we do to expand our scope, right, to go to impact other countries, not only Cameroon. That's why we came up with the idea of the Global Health Catalyst. So what we intend to benefit from the summit is that we want to see that people who are affected by certain diseases, in particular cancer, in Africa and other low and medium income countries, will be able to gain knowledge when medical officers from these countries come, right, and attend the summit. They'll be able to learn one thing or the other, and when they go back to the various communities, they'll be able to implement them. Also, the GSC, presently they are working on an online training program where some professionals from the Western world, they give lectures online when medical doctors come. They organize classes where medical doctors come and then they listen, they learn, and that is. Those are some of the things we intend to accomplish. Presently, we are working with some countries We are working with Rwanda, Tanzania, Nigeria, South Africa, Malawi, just to name a few. Those are the countries that we are engaging with seriously to see that we improve on their health facilities, we improve on the knowledge the medical personnel in these countries get to see that they will be able to meet up with any challenges that they are facing in the near future.
Yeah, I recently read that you are specifically trying to open up cancer institutes in those countries.
Yes. And Rwanda is like the pilot project. Rwanda is like a pilot project. So that's where we want to start, and then we'll see how we can expand to other countries.
Rwanda is proving to be a force to reckon with because it's piloting everything in Africa.
That's right.
Now.
We are so blessed that we have a leader in Rwanda who has a bigger vision, not only for Rwanda itself.
For Africa.
And then he has a bigger vision for Africa, and we think that's a great opportunity for us to use. And because we use Rwanda as a pilot project, other countries will be encouraged to open up their doors to us.
Right. So again, I needed you to speak a little bit about the Leadership Academy.
Yes, the Leadership Academy, you know, in every organization, for every organization to succeed, you must have strong and well-educated leaders.
Right.
So this year, we are trying to bring in an aspect of a Leadership Academy where we have training from Harvard faculty and some well-renowned researchers from the collaborative relational institution who will be giving us lectures, and some seasoned professionals who will be giving us training on how to carry out activities in our various communities. And this training is not limited only to diaspora leaders. It's open to every other participant who wants to attain. And this just goes to fortify what the leaders already are doing. But right. when you get some knowledge from some other person who is a little bit more experienced than you, it gives you a better way of carrying out activities back in your country of origin and in your place of settlement.
So who is eligible, and what is the process for the application process? Yeah,
every summit participant is eligible. What you just need to do is to go on the website www.globalhealthcatalystsummit.org. You register, you pay your fee, and when you have paid your fee, you just contact us. You contact myself or Dr. Lydia, and we'll sign you up for the training program.
That's excellent. I mean, you mentioned that the Global Health Catalyst Summit has happened for 5 years?
This is the 5th year.
The 5th year.
Yes.
That's amazing work. So you are a member of the Diaspora, obviously, and what I like to call the 6th region of the African Union. Can you share your experience working with these processes and programs designed to create catalytic development?
Thank you so much for giving me this opportunity to share my experience. I think my experience so far has been a positive one. Working with the Global Health Catalyst for this number of years, I've actually learned a lot in the health domain. For me, my background is business, so right. I'm a business student, but I've been so much engaged in health that has made me to put in so much effort in seeing that one day my continent will be compared to the Western world. So that is what keeps me motivated. But you know, in every situation, you must have challenges. Sometimes not being part of the summit is a challenge on itself.
Right.
But when we organize summits like this and people come and they build a lot of collaborations, they go back now in their various communities and will be able to carry out what we cannot be in those communities at the same time. And that helps to bridge some of the challenges that we are facing.
So just to echo what you're saying, you need us, regardless of our backgrounds, to be a part of the Global Health Catalyst Summit and processes, because we need the computer geniuses to do the coding for medical coding. We need business people to market the healthcare sector. We need the indigenous medicine practitioners to work with the doctors in research, right?
Yeah.
And so I think this is an opportunity for all the diaspora to identify areas that we as a diaspora can contribute to the development of motherland. So what additional information would you like our viewers to know about the leadership program and the Catalyst Summit as a whole?
Yeah, for the leadership program, if you see on the flyer that we have out, we'll be offering certificates after the training to people, which will go a long way to, let's say, beef up your CVs or your curriculum vitae.
Right.
So if you are looking for a job and somebody says, oh, I had a certificate from Harvard, that's from Harvard program, or they'll be so motivated. So I think that the Catalyst Summit, it's a big opportunity for people to come, learn, and share their experiences. Because when you have an experience and you sit with that experience, you don't know whether it is good or it is bad. But when you come and share it, you might have some people who might say, okay, no, if you can do it this way, we can do it this way, it's going to be much more helpful to you. So coming to the summit is an opportunity where we are asking for everybody in all walks of life to come and let's sit together, let's brainstorm, let's network and collaborate and see how we can help our motherland.
Excellent. I will definitely be there at the summit, God willing, of course. And I also look forward to hosting Dr. Lydia Asana and the bigger team. And we wish you well with the Global Health Catalyst Summit. For the benefit of the French-speaking diaspora, what are the details for the registration?
Je vous invite tout le monde à nous joindre à partir du 24 au 26 mai 2019 à Boston. L'adresse c'est 450 Brookline Avenue, Boston, pour la Global Health Catalyst Summit. Là, tu vas trouver plusieurs choses que si tu restes chez toi, tu ne peux pas trouver. So what I just said in French is that I'm inviting everybody to join us from the 24th to the 26th of May 2019 at 450 Brookline Avenue for our summit, where you come and you will learn a lot. But sitting in your house, you might not be able to get this information. And I also ask our viewers to go to our website, www.globalhealthcatalystsummit.org, where you will learn and see what we have been able to do so far for the number of years that we have been in existence.
It's interesting. I just wanted to add that the Global Health Catalyst over the years has had very, very, very influential and successful presenters who in the medical field, politicians, and business people. So it is an opportunity for us to network, engage, and collaborate. So I urge everybody to participate. I want to specifically thank you for your contribution to healthcare development through the Global Health Catalyst Summit and for making the time to be my guest on Africa to You.
Yeah, you are welcome.
So for more about Africa and African diaspora, visit africatoyou.org or send me an email at africatoyou.vivian@gmail.com. You can also watch our episodes on our YouTube channel. Thank you for watching Africa to You. Till next time.